Everything's on the table, and if we move forward and we decide to do a further lockdown, there's a lot of things to take into consideration. There's the education, making sure that we have daycare, making sure the educators are ready, making sure that we, as simple as having hotels for people that have COVID, that we can put them into hotels instead of at home. We have to make sure that we have something for the businesses. We just can't keep going on like this for these poor business owners, small business owners. We have to make sure there's some help for the business owners as well. And we have to make sure that the healthcare system, the capacity, come up with some other alternatives, as we're doing with long-term care. Maybe do we put interim hospitals out there? So there's a wide variety of items. The discussions were going the last couple of days. Matter of fact, they're ongoing constantly. Last night, they'll be going today. But there's a lot of things to consider. The worst thing we could do is rush out there and make a snap decision in a heartbeat. We have to make sure, if we do make this decision, is it going to be 2 weeks? Is it going to be 3 weeks? Is it going to be 28 days for a full cycle? So there's so many things to consider. But again, Laura, I won't hesitate, will not hesitate to do whatever it takes to slow down this trend that we see and get it back well within the numbers that we can control in our hospitals right now. That's the scary part, Laura. When I talked to a doc yesterday, and he told me that he was talking, he had to cancel a surgery for a 42-year-old male patient that has cancer. That we just can't keep going in the way we're going, and because the ICU beds are taking up from COVID patients. So there's a lot of stuff to consider, and it's all hands on deck right now. And I got to thank everyone for helping out, all the docs and the hospitals and frontline healthcare workers.
Follow up.
Thank you. Premier, I just want to clarify, when you're talking about considering, whether it's 2 weeks, 3 weeks, 28 days, are you talking specifically about a school closures? Or are you talking more generally about lockdowns? And you also mentioned daycares in there. So if you do choose to extend the winter break, for instance, as Quebec has done, would you also close daycares? And how would you help those essential workers who will have to continue going into work if they have children as well?
Well, we'll make sure, as we did before, that we'll have daycare if we make that decision. And I know the Minister of Education has put the schools on notice as well. So it's all hands on deck. We have to be ready for anything, and the trend is moving at a rapid fashion right now. So we're going to be ready.